We were talking earlier, and I'll just jump right in. I know you are spending your time thinking about the adult dental space and how we can sort of, I feel like we're still righting the wrongs of eliminating that program in Medicaid from a decade ago, and we're playing catch up. Tell me your thoughts on that program.
Yeah, so Arcora Foundation is an oral health foundation funded by Delta Dental. So dental is our world, oral health is our world. So definitely thinking a lot about the Medicaid dental program, the 2 million people that get their coverage through Medicaid, and the significant unmet need there really is, especially for the adults in the program. Only about 1 in 10 adults on Medicaid get any sort of preventive dental care. Less than 25% get any care at all. So there's huge need. Every year, used to be at the Key Arena. I think this upcoming February, it's going to be spread across the Seattle Center, but as a free care event, healthcare, medical, vision, dental. The number one thing people show up and ask for is dental. So really looking for what is that opportunity to make a significant leap forward in our state around oral health care, especially for vulnerable adults. There are states that have done comprehensive Medicaid dental reform that has made a difference, and we could look at doing that here.
Yeah. One of the things that some states have done is they've had dental be part of a managed care plan. In some cases, that has been rolled into a managed care organization or a community coordinated care organization like those in Oregon. This state has had a real hard time doing managed care and dental. In many cases, it just feels like we're lagging on dental policy. Is that your sense of this as well?
I would say that our state's done a great job making incremental improvements, especially for the early childhood population. Mm-hmm. We actually lead the country for young, low-income kids accessing dental care. There's great programs. Today's the 20th anniversary. This year is the 20th anniversary of the Access to Baby and Child Dentistry program. That's been a lot of help with the Medicaid program for young kids. But I do think we're a little stuck around kind of making a significant infrastructure improvements with the Medicaid dental program. And there was a lot of attention to the Medicaid dental program the last couple sessions. A lot of great dialogue happened. Ultimately, moving to a dental carve-out, managed care carve-out was halted, which I think was probably the right thing, because the conversation really was around saving money within the program. And when we look at the hundreds of thousands of adults that are just going without care, we obviously want to be spending money wisely and reducing ER visits, reducing the number of kids that get dental care in the operating room at $15,000 a pop, reducing the diabetic complications that stem from untreated infection in the mouth. So we want to invest smartly, but the unmet need is so large that it is going to take more investment in the program to really get to where we want to be. So I do think that there's momentum building. I think there's a lot of great opportunities in our state to look at what are the unique factors we have here to make a program work really well. And I think it's time.
Arcora, as you know, was at the table very early related to ACH's, Accountable Communities of Health. Back when that legislation passed in 2014, and you guys were at the table making sure that oral health could be one of the programs that could fit into ACH investments, and trying to make sure that was infused in the conversation. Now that we're well into the ACH experiment, what would you like to have had us do as a state 6 years ago in 2014 when we were first passing legislation, first getting this envisioned? What should we have known then that we know now, but which would have helped us?
Great question. You ask hard questions. I would say the opportunity to include oral health in the transformation efforts was great, and it was definitely something that I'm proud that our organization did, was to show up early and really introduce oral health and dental into the conversation about regional health transformation. And because of that, oral health was included as an optional issue that ACHs could take on. And I think what we've learned through working with the ACHs over the last 6 years is is that they all have a lot of interest in oral health, and even if they haven't selected it as a specific project, they're finding ways to integrate it in, because oral health doesn't need to be kind of standalone on the side. That really, if you're working on care coordination, you can integrate oral health strategies. If you're working on other areas, social determinants of health, that the same root causes for oral disease are causing other health issues. And so to have separated it out as opposed to really have addressed the regional transformation as kind of the whole person health that includes oral health from the beginning, I think was something maybe that we could have caught earlier on.
Mm-hmm. This is a little bit in the weeds, so you can take a pass on this if you want. No one will know. But on the future of ACHs, do you have any thoughts on how we're going to keep those around? I mean, absent a lot of waiver dollars, there's just no clear pathway, and I don't see political will lining up anywhere to keep those around at the state level. Maybe I'm wrong. I'm certainly not involved in conversations on all this stuff. But what do you think about that question?
I think there's probably folks in this room that are a lot wiser than me on that question. But one of the things that our foundation's been able to do is really build off of the ACH infrastructure and some of our ability to fund local and regional efforts. For example, local impact networks that we've launched in Spokane with Better Health Together, with the North Sound ACH. And so it's building off of the infrastructure and the expertise of the ACHs around bringing diverse constituency groups and stakeholder groups around the table to address an issue. In the local impact networks, the goal is to improve health equity through reducing oral health disparities. So the HCHs are really helping to make that happen on the ground. So I guess from our perspective, we'd love the ACHs to, be able to be there and continue that work. And as a funder, look for ways that we can kind of help supplement the other funding that they have so they can continue.
Yeah, good stuff. Diane Oaks, CEO of the Arcora Foundation, thank you, ma'am, for being here with us. I appreciate it.